Hello guys, welcome to our channel. I'm in Med for a new video on PYQs from the topic middle ear pathologies, acute suppurative otitis media and non-suppurative otitis media. Support this video by liking, sharing and subscribing the channel. Let's get straight into the video. Throat infection causes ear infection through A. Blood spread, B. Eustachian tube, C. Nasocranial spread, D. Simultaneous infection. The answer is D. Eustachian tube. It is the most common route of infection in middle ear. Travels via the lumen of the tube or along subepithelial peritubal lymphatics. Commonest causative organism for ASOM in 2 years child is A. Pneumococcus, B. H. influenza, C. Staphylococcus, D. Streptococcus. The answer is A. Pneumococcus. Most common cause of acute otitis media are as follows: Streptococcus pneumonia or pneumococcus, 35 to 40% cases. Haemophilus influenza, 25 to 30%. Moraxella catarrhalis, 10 to 20% cases. Cartwheel sign is seen in A. ASOM, B. AOM, C. OME, D. CSOM. The answer is at ASOM. Otoscopy signs of ASOM. There is congestion of pars tensa. Leash of blood vessels appear along the handle of malleus and at the periphery, giving it a cartwheel-like appearance. Translucency is reduced. Later tympanic membrane appears red and bulging with loss of landmarks. Tympanic membrane is immobile in pneumatic otoscopy. Acute suppurative otitis media is treated using all except A. Erythromycin, B. Penicillin, C. Streptomycin, D. Cephalosporin. The answer is C. Streptomycin. Medical management is the treatment of choice in a case of ASOM. Antibiotics of choice are ampicillin or amoxicillin is the drug of choice. Others which can be used are cotrimoxazole, cefaclor, erythromycin, penicillin. Lighthouse sign is seen in A. ASOM, B. CSOM, C. Meniere's disease, D. cholesteatoma. The answer is A. ASOM. Lighthouse sign is seen in acute ASOM and in acute mastoiditis following ASOM. There is mucopurulent or purulent discharge, which is often pulsatile. On otoscopy examination of ear, this pulsatile discharge reflects light, which is called as lighthouse effect. A boy with ASOM undergoing treatment with penicillin therapy for 7 days now presents with subsidence of pain and persistence of deafness. The diagnosis is A. Ototoxicity, B. Secretory otitis media, C. Adhesive otitis media, D. Tympanosclerosis. The answer is B. Secretory otitis media. Inadequate antibiotic treatment of acute suppurative otitis media may inactivate infection but fail to resolve it completely. Low-grade infection lingers on, which acts as a stimulus for the mucosa to secrete more mucus, which leads to development of serous or secretory otitis media. Cause of unilateral, secretory otitis media in an adult is A. CSOM, B. Nasopharyngeal carcinoma, C. Mastoiditis, D. Foreign body of external ear. The answer is B. Nasopharyngeal carcinoma. Unilateral serous otitis media in an adult should always raise the suspicion of a benign or malignant tumor of nasopharynx. Secretory otitis media is diagnosed by A. Impedance audiometry, B. Pure tone audiometry, C. X-ray, D. Otoscopy. The answer is A and D. Impedance audiometry and otoscopy. Pure tone audiometry gives information about the quantity and quality of hearing loss. In secretory otitis media, conductive deafness of 20 to 40 decibel is seen, which is not specific, as seen in many conditions. Therefore, pure tone audiometry is not diagnostic of serous otitis media. X-ray mastoid shows clouding of air cells. Not diagnostic. On otoscopy, tympanic membrane appears dull, opaque with loss of light reflex. Impedance audiometry is an accurate way of diagnosing serous otitis media. It shows type B tympanogram, which is diagnostic of fluid in ear. Bluish tympanic membrane is seen in A. Early ASOM, B. Glue ear, C. Cholesteatoma, D. Cholesterol granuloma. The answer is B. Glue ear. In glue ear, tympanic membrane is dull opaque with loss of light reflex and appears yellow or gray or blue in color. Normal color of tympanic membrane is pearly gray. Congested membrane with prominent blood vessels, cartwheel sign, is seen in early stages of acute otitis media. Bluish discoloration is seen in hemotympanum. Also flamingo pink color is seen in otosclerosis. Treatment of choice for glue ear is A. Myringotomy with cold knife, B. Myringotomy with diode laser, C. Myringotomy with ventilation tube insertion, D. Conservative treatment with analgesics and antibiotics. The answer is C. Myringotomy with ventilation tube insertion. Treatment of choice for glue ear is insertion of grommet, ventilation tube insertion. Tympanotomy or cortical mastoidectomy has a very limited role and is not done nowadays for serious otitis media. Tuberculous otitis media is characterized by all except A. Multiple perforations, B. Pale granulations, C. Pain, D. Thin odorless fluid. The answer is C. Pain. Tubercular otitis media. Important points. Seen mainly in children and young adult. It is secondary to pulmonary tuberculosis. Route of spread mainly through eustachian tube, not bloodborne. The common symptom are patients often present with chronic painless otorrhea, usually foul-smelling, which is resistant to antibiotic treatment. Severe conductive type hearing loss, sometimes due to involvement of labyrinth, may be SNHL. Facial nerve palsy may be the presenting symptom in children. Cough, fever and night sweats may be present in patients with tuberculous infection in other organ system. On examination, multiple perforations in tympanic membrane, once considered characteristic of TB, middle ear and mastoid are filled with pale granulation tissue. It is a characteristic of tuberculous otitis media. Do like, share and subscribe. And comment which topic PYQ you want. Thanks for watching.